is Professor Louise Dubras, and I am the Foundation Dean of the School of Medicine here at Ulster University. And I'm here with my colleague, Dr. Patricia Harris, who is our Director of Education and the Director of the MBBS programme. You are all really, really welcome here this evening. We have an hour set aside. We will talk you through the MBBS programme and give you a bit of information about GAMSAT and how you study, what you study and where you study. And then, as I've said, we'll do our very best to answer some questions. With so many of you on the webinar, we may not get to everybody's question. Okay, so as I say, we're going to talk about some of the very exciting updates on funding for 2025 entry. We'll talk about the course, we'll talk about kind of those key dates and stages in the application process, and then have an opportunity for questions and answers. Just to say, by the way, in relation to questions, please don't do putting your hands up. It's a whole load easier if you put questions into the chat, because neither of us are going to be able to deal with all the hands that might go up. Right, so I guess this is a really important place from which to start, and that is that we've been delighted with the recent announcement from the Minister for Finance in Northern Ireland, Conor Murphy, who has confirmed that graduate entry medical students on the graduate entry programme here at Ulster will be entitled to a tuition fee loan from Student Finance Northern Ireland. This has not previously been available because there was not an allowance for students who were taking a second degree. But there has been recognition that that graduate entry medicine is a unique position, that it's really important for us to be aiming to grow our workforce for the future, and that the graduate entry course is an intense course which has very limited opportunities for students to earn additional money. So this has been incredibly welcome. So as you can see on the slide there, this will be available to students from Northern Ireland and the Republic of Ireland who meet residential criteria, available from Student Finance in Northern Ireland in 2025, and the application window usually opens in the spring of next year. And there's a web link which you can go to for further information. So wonderful news there if any of you are considering joining us on or applying for the course. So what I want to do is just take a little bit of time to think about where you'll study and who you'll study alongside. And I suppose this is just about the context of Ulster University. So we sit as the School of Medicine within the Faculty of Life and Health Sciences. In our faculty, we're one of 8 schools. The other schools in our faculty include the School of Nursing and Paramedic Science, the School of Health Sciences, which is most of our allied health professionals, the School of Pharmacy, School of Sport and Exercise Science. We also have psychology, geography, but very much a concentration on life and health sciences. What you can also see on that slide is where we are across Northern Ireland. So if you are familiar with our geography, you may be familiar with our campuses, but what you can see is that we have a significant campus in Belfast, where a number of our postgraduate nursing and allied health professions courses are, and also the Belfast School of Art, and also engineering, built environment tend to be focused in Belfast. You can see there at Coleraine, we have our School of Biomedical Sciences, the School of Pharmacy is also there, and some of our sports provision. And then you can see here the campus that we refer to as McGee, which is our Londonderry campus up here in the northwest. And here we have undergraduate nursing, paramedic science, our undergraduate allied health professionals programs. Obviously here in the School of Medicine, we have the MBBS program, the Physician Associate program, and personalised medicine. And then there's also drama, music, some computing, and some law and some business here on our campus. So that gives you a sense of our geography and of what goes on in our faculty. And we'll tell you more about what goes on in our school as we move through the presentation. So focusing on our MBBS students, we accept international applicants? We absolutely do. And our students have come from almost all counties in Ireland. They come from Great Britain, and they come from a range of countries internationally. We are capped in terms of numbers of international students. That's capped by the government, and we're allowed up to 7 international students who would join us in any one year. But the process for application for you, if you are an international applicant, is through UCAS, exactly the same as any home or GB students. And if you look at the previous degrees that we accept, what you can see there is the profile of our entrants in the 4 years now that we have been taking students. So what you'll see is that there's a really nice healthy mix, healthy balance there between students who have prior qualifications in a health-related subject. So we've listed there pharmacy, physio, nursing. We also have dental, we have physician associates. And then you can see science backgrounds. So those people with backgrounds in anatomy or chemistry or biomedical sciences. But actually, I think very interestingly, and hopefully if you are from a non-science background, you will be really encouraged by the figures that you see there. So we have students who come in from a range of non-science backgrounds. That includes languages, it includes accounting, it includes human resources, it includes photography, music, and those students we know, and when we talk about the GAMSAT, we know that if you are one of those people, you have to have demonstrated enough science knowledge to us at the point where you take the GAMSAT for us to know that you can cope with the course. And of course, what you bring, if you are one of those students, is you bring wonderful perspectives on what it means to be a doctor, what it means to be a patient, and about the experience of health and experience of illness. Just to pick up on the question of how many places there are a year, you might have been doing rapid maths from the 7 that I talked about who are our maximum number of international students. That's 10% of our number. So we can take up to 70 students who we regard as home students. So that's from Northern Ireland, the Republic of Ireland and Great Britain, and then up to 7 for international entry. Okay, now I'm going to pass to Dr. Harris, and she's going to take on the next section of the presentation. So
thank you very much. It's lovely to have so many people on the call this evening. My next few slides are to talk to you about our course here for Graduate Entry Medicine. And the one thing that I think is really important for anyone who's considering applying to consider is the approach we take to learning. We are a problem-based programme. That means that you will learn in small groups, and for that reason it's really important to us that we have the mix of previous degree backgrounds that Professor Dubras has just discussed on the previous slide. That rich diversity of your previous backgrounds and students from different socio-economic and kind of social backgrounds makes our problem-based learning a really interesting and rich environment. With problem-based learning, if you haven't done a lot of reading into it, I would certainly encourage that you do that before applying, or at least before undertaking an interview with us. Problem-based learning is a very student-centered approach, and it's a very independent approach. So it requires you to engage with your prior knowledge, things you already know, things you don't know, and then designing weekly learning plans for yourself based on your kind of knowledge gaps and your areas of interest. And then once you have done that kind of independent study, you're bringing it back to your small group and discussing what you've learned, what other people have learned, and kind of comparing and contrasting across the week. And that's a very exciting way of learning. It really helps with your consolidation of information and means that you are learning all the way through the year instead of kind of cramming study in at the end, as some of us might have been used to in previous areas of study. Something else about our problem-based learning approach is the integrated way in which we build in the topics. So we have clinical and communication skills on a weekly basis, and this is something that in your early years of study you will do every week, and it is designed to fit nicely with your problems that you're working through during the week. So you will get a new clinical-based problem, and that is what you will revolve all of your study around for the particular week, including your clinical and communication skills. And in our program, there's a really heavy emphasis on general practice and primary care, and all of our clinical and communication skills tutors are practicing GPs. And we think that's very important for you to see the breadth that there is in general practice, and to meet as many clinicians as you can during your study. We also deliver a very technology heavy, technology enhanced anatomy program. Again, that's built into your problem of the week, your case of the week, where you'll learn your anatomy alongside the kind of clinical relevance of that anatomy. And similarly with the pathophysiology, so the mechanisms of disease, you will learn that alongside your normal physiology, and that will help you consolidate all of this information around a particular topic of that week. You will also get lectures that are delivered by experts in those fields. And something that again really helps with the consolidation of learning is the early patient contact. So within the first month of the program, you will go out to a GP for the first time, and you will be putting into practice what you have learnt over the first few weeks. And something else that I think is an important feature of our curriculum and of our program is our approach to students as partners. It's really important to us that students help us shape the curriculum and give us feedback to help us enhance. And anyone who comes onto our program will have multiple opportunities to feed in, whether that's through the course rep process, or whether it's through one of our committees, for example, the EDI student committee. So if that's how we teach, with a real emphasis on that independent study and the small group work, and your access to clinical experts, you're probably also wondering about our placements and our approach to placements. So the picture on the screen here demonstrates the 5 different trust areas across Northern Ireland. So each colour is a different trust area, and you'll maybe be able to see the purple there, kind of centre right, which is the Belfast Trust. So we have 5 different trusts in total. We're up at the top in the yellow, over to the left, where the arrow is pointing to Altnagelvin Hospital. That is our nearest hospital. It's just across the water, if anyone is familiar with the layout of Derry. And we're not very far from the hospital, just a kind of 15-minute drive, and there's buses, lots of nice easy links to get up there. And across the whole of Northern Ireland, we have actually over 80 GP practices that we work with, and they're spread right out across Northern Ireland. So as a student on our programme, you will get a really wide range of experiences. And one of the questions that we often get asked is kind of where might I be based across the 4 years? And the answer to that is that it's very variable. Students will be based across all 5 trusts, and your allocation will be given to you usually around this time of year. Actually, in your first year, you would be told which trusts we intend to send you to for your second, third and fourth year. And in your first year, you stay in primary care and you stay in the same GP practice for all of your placements across first year. So you'll get to know that practice very well. So as well as the spread of placements, students often, or applicants often ask whether they can pick where they go for their placements. And the answer is usually no, but we do have something called a pre-allocation process. And this is very similar to what happens in postgraduate training for foundation doctors. Students with particular needs, such as caring responsibilities, can apply for pre-allocation to a particular geography. And we try our best to keep you in and around that area if you have if you get pre-allocation, as I said, for things like being a carer or having dependents. I'm now going to move on to the application process. So we've had a little look at the programme itself, where you study, who you study with, and how we approach the delivery of the medical degree here. But let's have a look at the application. I think a number of you have either applied through UCAS already or are considering applying through UCAS for August 2025 entry. But I also know there's a number of people on the call today who have expressed an interest in the August 26 entry, and the information that we'll cover over the next few slides will be relevant to everybody. So at the moment, in the application timeline that we're in, I would encourage anyone who's on the call who's thinking about medicine, first of all, to check the entry criteria on the website if you haven't already done that. You'll see on the website that the entry criteria require you to have certain GCSEs in English and maths, and that's the same for all degrees here at Ulster, that you need to demonstrate a certain level of English and maths. You then also need to have a first degree, a previous degree at the level of either 2-1 or a first. And we've already mentioned about the types of degree backgrounds that we see people coming onto our programme with, and we do not stipulate any need for any particular subject in your previous degree. So anybody in any subject can apply if they have or intend to have a 2-1 or a first. You'll also notice in the entry requirements that we need you to sit something called the GAMSAT, and that is an entrance test that we'll talk a little bit more about in a moment. The application deadline through UCAS is the 29th of January, and that is for anyone who wants to apply and start with us in August 2025, so this coming summer. And so if that is your intention, you need to put in a UCAS application before the 29th of January. You will then also need to register for and take this GAMSAT entry test. And what we'll then do is, at the university side, we'll review all of the applications that come through UCAS. We will await the GAMSAT results, which normally come into us in April, May time. And then those who meet all the criteria will be invited along to an interview, and that's in June. And then, as I said, the course starts on the 18th of August. So some of our frequently asked questions are around the application process and UCAS and what you need to put into UCAS. And often people are wondering, do you need to demonstrate previous experience in healthcare? And the answer is no. What we're looking for are people with the right values and behaviours to study medicine. So if you can demonstrate that you can be a team player and that you're have good communication skills and you like working with people, you can demonstrate that in any previous area. It doesn't have to be in healthcare. And the entry requirements, as I said, are all on the website. You're best to have a look at those individually to see how they apply to you. So I mentioned this graduate entry test, so the GAMSAT. And the GAMSAT is a test of people's aptitude for studying kind of high level degrees such as medicine. And it includes 3 different parts. So there's a humanities section, there's a science section, and there's a written communication section. And students need to register for this test, and registration is open now. And you can use the QR code that's on the screen to go through to the registration page of the GAMSAT. Registration closes on the 20th of January for the March sitting of the GAMSAT. So if you're intending to take the March sitting of the GAMSAT because you want to study with us from August of this year, then you need to make sure that you have registered with the GAMSAT by the 20th of January. This GAMSAT test is what allows us to be confident in taking applicants through who have had any degree background, because we're able to make standardized judgments across different applicants, and that means that our application process is fair and our offers are made fairly regardless of your degree background. The humanities section and the biological sciences section of the GAMSAT is delivered in various different test centres, and we have a test centre here in Derry, but there are other test centres in the UK, Ireland and abroad. The 3rd section of written communication is delivered remotely. So you undertake that at home or perhaps at your college or somewhere where that you can sit and concentrate. And that is done with remote proctoring or remote invigilation. If you live somewhere where you are more than 3 hours away from a test centre, it's also possible for you to be able to take the humanities section and the biological sciences section remotely as well, and that is all arranged through the GAMSAT, so you can check out all of their details on the website. There is a cost for the GAMSAT, but I would encourage people to have a look at the bursaries that are available on the GAMSAT website if you meet the criteria that are there. So once you've completed the GAMSAT, and if we have an application in from you through UCAS, I said that we would get the results from GAMSAT around May, and at that point we will review your GAMSAT results alongside your application. And for people who meet the criteria, our minimum GAMSAT is kind of 50 across the piece. And depending on your scores within each of the individual components and on average, you will hopefully be invited along to an interview. And the interviews here at Ulster are what we call multiple mini interviews, or MMIs. So these stations are testing those core values and behaviours that I mentioned are important. And before you would go and sit a multiple mini interview, I would definitely recommend having a look at the documents that I've listed on here. So the GMC's Achieving Good Medical Practice. And those are the standards that medical students are expected to uphold as they're working towards good medical practice, which are the standards that doctors are held to. There are also a really, really helpful section on the Medical Schools Council website that talks about the attributes that are needed for medical students and for doctors, and that will give you a really good sense of what it is we are looking to assess through our interview. We also will run an MMI webinar for anyone who is offered an MMI slot. And I would definitely encourage you to come along to that, because that is where we will tell you how the MMI runs, what exactly we're looking for, and therefore how to prepare. And I will pass back to Professor de Bra to talk to you about what happens after, if you are made an offer, and then start with us here on the medicine programme.
Thank you so much. So this invites you to look into the future, and it is quite a long journey, but don't let that kind of make you too despondent. I think we started talking about finances, and I think one of the things that applicants and certainly students are thinking about is that journey beyond. Now, this is a 4-year program, and it's only during the 4 years of your study on the program that you don't earn. But if we, and I'll just walk you on this timeline. So if you start with us in 2025, that means that you complete your first year in the summer of 26, second year in the summer of 27, third year in the summer of 2028, which means you would graduate in 2029, which in itself feels like quite a long way away. However, the time goes very quickly. At the point of graduation in the summer of 2029, you enter postgraduate training, and at that point you start working as a doctor and you start earning as a doctor. Now, what I've got on here is progression into foundation training. That's the UK foundation programme. Some of our graduates are exploring the possibility of entering into the internship programme in the South, but for the purposes of this presentation, I'll just focus on transition through the UK training system. Foundation training, as things stand legally at the moment, is a requirement to have full registration with the General Medical Council. At the point where any medical student graduates within the United Kingdom, they only have what's known as provisional registration. And you have to complete Foundation Year 1 at the least in order to secure full registration with the GMC. Now, progression then through Foundation Year 2, if you like, consolidates that learning. And what happens thereafter is you begin to think about specialties. What we do for you as you go through your clinical learning here in the medical school, as would happen with any other medical school, is you get opportunities to sample the main hospital specialties alongside general practice. But of course, there are in the order of about 60 different medical subspecialties that you can train in. And although we'll give you some opportunities to sample any of those that you're interested in, of course, you're not necessarily going to have the opportunity to think about all of those. So what happens as a foundation doctor, and then as you're thinking about heading into the rest of your postgraduate training, is you're thinking about what specialty, you're thinking about the extent to which you're going to sub-specialize. But all of this takes time. The shortest training, interestingly, for what I would argue as a GP myself to be the most diverse clinical role as a general practitioner, is only 3 years. So if you imagine that you would then complete GP training in that academic year ending in the summer of 2034. That's actually 10 years from now. So it is possible that if you joined us summer of 2025, you would be a completely trained GP 10 years from now, which is probably quite an incredible concept. Now, if you wish to train in hospital specialties, that's really where the 3 lines below there would start to apply for you. So there are other specialties, and that might include medicine and a range of medical specialties. It can involve surgery and a range of surgical specialties. I mean, those are really, really broad criteria. And then you start thinking within those medicine or surgery kind of broad headings, you think about respiratory medicine or cardiology or renal medicine or dermatology. With surgery, you might be thinking about general surgery, colorectal surgery. You might be thinking about cardiothoracic surgery. You might be thinking about neurosurgery. Either way, the more subspecialist you get, obviously, the longer the training programs and the more competitive they are. What you'll see there when we talk about core training and specialty training is some programs will take you for 2 to 3 years as a core trainee, and from there you will then apply again for a specialty program. And then what you'll see, that sort of lilac box at the bottom, is specifically if you're interested in anaesthetics or intensive care. And that is ACCS, which stands for Acute Care Common STEM. Again, that's 2 to 3 years of common STEM. And then the specialty is to take you specifically into anaesthetics or into emergency medicine or into intensive care. But I think to address the question really that we do get asked from time to time about whether or not you're too old to study medicine, my response to that is that I think it's important for you to think about, certainly to think about the intensity of your education as a graduate entry student, and then the intensity of postgraduate training, but actually to recognise that you will have a long enough career working as a doctor. Whether we like it or not, your retirement age is going to be a bit further out than my retirement age. And so you may well, even if you're graduating at the age of 40, for example, the likelihood is you're going to be working for a good 25 years. That means that you can give great service to patients, have a real impact on patients, even bringing that extensive life experience with you to that. So we don't have an upper age limit. What I do say to people is if they have specific concerns or worries, then it's a good idea to talk to us. But I tend to encourage you, if you are a kind of beyond that, I've just completed my first degree position, to not to discount medicine as a career. And obviously I'm going to tell you what an amazing and rewarding career it is, because it is. The other thing that people do sometimes ask us is whether you can directly come into year 2 of the MBBS program. Now, hopefully you've seen from what Dr. Harris was saying earlier in the presentation, that the nature of our learning is extremely integrated. And what that means is that we can't bring you directly into year 2. There's far too much that's kind of covered and embedded in year 1 that is the foundation that you then build on for year 2. In terms of, well, your kind of responses, which might be, I have a background in, or I've already done that. It comes again back to the comments and the points that Dr. Harris was making about the fact that you work in groups. And actually, if you are somebody who has particular skills or particular expertise in certain aspects of healthcare, so for example, if you have a nursing background or a pharmacy background, you may think to yourself, well, I already know this, but of course others in your group may not. And it's often an opportunity for you to demonstrate how you work as a member of a team to upskill everybody in that group. And of course, remember, that if you have a background in nursing or pharmacy, and you're working with somebody with a background in computing or engineering, they will know things that you don't know, which are equally relevant, and they will see problems differently to you. So that's a long way round of saying, sadly, no, you can't enter directly into year 2. But because the programme is concentrated, it's very integrated, and because of the way in which you learn, we believe that the 4 years is really the minimum time that it will take you to qualify as a doctor.